In this section, we'll go over the steps of inserting basic airway adjuncts. The first basic airway adjunct is a device called an oropharyngeal airway, or OPA, and it's used in unconscious patients who are at risk of developing airway obstruction. Inserting an OPA is fairly simple with the right training. Step 1 is to clear the mouth of any blood or secretions with suction. Step 2 is to select a size-appropriate airway device. Step 3. Place the device at the side of the patient's face. You'll want to choose a device that extends from the corner of the mouth to the earlobe. Next, insert the device into the mouth so that the point is toward the roof of the mouth and parallel to the teeth. Lastly, step 5. Once the device is almost fully inserted, turn it until the tongue is cupped by the interior curve of the device. The next device is an NPA, or nasal pharyngeal airway, and it can be used on either conscious or unconscious patients. Inserting an NPA is rather similar to inserting an OPA. First, select a size-appropriate device for the patient. Next, place the device at the side of the patient's face. Like the OPA, make sure to choose the device that extends from the corner of the mouth to the earlobe. Also try to use the largest diameter that will fit in the nostril. Step 3 is to lubricate the airway with a water-soluble lubricant or anesthetic jelly. Step 4. Insert the device slowly, moving straight into the face, not towards the brain. Step 5. Ensure that the device is snug without being forced or stuck. If it feels stuck, remove it and try the other nostril or a smaller NPA. Suctioning is essential to maintaining an airway. Suction the airway immediately if there are secretions, blood, or vomit. Do not suction for more than 10 seconds. To avoid hypoxemia, follow suctioning attempts with a short period of 100% oxygen administration. Monitor the patient's heart rate, pulse oxygen saturation, and clinical appearance during suctioning. If a change in monitoring parameters is seen, interrupt suctioning and administer oxygen until the heart rate returns to normal and clinical condition improves, and assist in ventilation as warranted. Here are some tips on suctioning. Do not insert the catheter too deeply. Sterile technique should be used near bronchi. Each effort should be no longer than 10 seconds. Keep in mind that the patient will not get oxygen during suctioning. Monitor vital signs and stop if the patient experiences hypoxemia, new arrhythmia, or becomes cyanotic. This concludes basic airway adjuncts. Next, we'll look at steps of using an AED. Thank you.